about cumulative injury disorders and how that connects with ART?
Yeah, so cumulative injury disorders is something where it could be from either overuse, from active injuries, or sustained hypotension from postural syndromes. When those things are happening, it creates a damage to the tissue, which leads to scarring and tightness. And we could show you a graphic to describe that. But the bottom line of it, Dr. J, would be this, like to keep it simple is, as I tell patients, if you pictured a paintbrush and all the bristles, it would be free, right? If we took that paintbrush and we painted something and we didn't clean it out, the bristles would become hardened, right? That's an example, very easy example of how we could picture the texture and the tension of, in that case, the paintbrush being changed. That's kind of what happens with the muscles from overuse, from trauma, and from postural syndromes. It changes how it feels, it changes how it moves, and it ultimately has an effect on blood flow, which is oxygen. An easy way to think about that, but affects, in a sense, the muscles, the tendons, the bones, the blood vessels, the fascia, and the nerves. All that stuff kind of gets affected.
How do you go about diagnosing that kind of a problem?
We do that with our hands so that we could find the exact tissue involved. We want to be able to feel, is the tissue moving properly, or is it kind of adhered to its neighboring surrounding structures? When we can do that and we can kind of figure out, is it a tear to the tissue, is it an adhesion? Then we may be able to put a name on it, like it's a syndrome of carpal tunnel syndrome or tennis elbow, something like that, right?
Okay. How does the tissue, movement of the tissue, how does that all work? When you're looking at soft tissue, that's a whole different scenario.
There's depth to tissue, right? So it's not all about just put my hand on a thigh, for instance, and what do I feel? I may have to go through a couple different layers and understand, what am I feeling? Is it the muscle? Am I dealing more with a fascial limitation? Is there a nerve entrapment? So I think the biggest thing to this diagnosis that we're talking about really is incumbent upon your touch.